Welcome to The Explainer. Today, we're going on an incredible microscopic journey, and you are stepping right into the shoes of a medical detective. Our bodies are just unbelievably intricate machines, right? Well, in this Explainer, we're going to decode the complex mysteries of human health and disease. We'll be zooming way in to look closely at the cellular clues that reveal exactly what goes wrong when our systems break down.
To do this, we've got 4 core pillars on the agenda today. General pathology and inflammation, then we'll move into oncology, where we track down rogue cells. After that, we dive into hematopathology to look at blood in crisis. And finally, we'll pull back for the big picture with systemic pathology. All right, let's jump right in.
Section 1, General Pathology and Inflammation. This is where all disease truly begins, right down at the cellular level. When a cell loses its ATP power source, the whole balance fails, setting off a really fascinating, yet pretty destructive chain reaction.
So think about cell death in 2 completely different flavors. On one hand, you have necrosis. You can think of this as the chaotic, messy bursting of a cell that's just been traumatically injured. It's violent and spills its contents absolutely everywhere. On the flip side, we have apoptosis. Now this is highly organized, programmed cell death. The cell essentially neatly folds itself into compact, easily managed little packages. It's the stark difference between a messy explosion and a carefully planned building demolition.
And that brings us to our first clinical pearl, a high-yield fact for your diagnostic toolkit. Let's talk about coagulative necrosis. When someone suffers a myocardial infarction, a heart attack, the sudden loss of blood flow causes that heart tissue to die. But because the cellular proteins denature before they can fully break down, it leaves behind this ghostly tissue outline that you can actually see under a microscope almost instantly. It's quite literally a shadow of what the tissue used to be.
Following tissue death or injury, the body obviously has to respond. Enter acute inflammation. Imagine neutrophils, which are your frontline white blood cells, sprinting through your blood vessels in a high-speed police chase to reach the site of injury. When they finally arrive, they trigger the 5 cardinal signs of inflammation in the tissue. We're talking redness, heat, swelling, pain, and loss of function.
But what if that initial threat isn't eliminated right away? That's when we cross over into chronic inflammation. This is no longer a quick, high-speed chase, it's a gritty, long-term standoff. The macrophages take over the scene, and they start building these massive granuloma walls to physically barricade the persistent threat. Seeing all this intense cellular warfare brings up a really common assumption, so it's time for a myth versus fact check. We hear about anti-inflammatory diets and medications constantly, right? So you might be wondering, is inflammation always the enemy in the human body? Is it just this destructive force we need to eradicate?
Fact, it is absolutely not the enemy. Inflammation is actually the essential fire that cleans out the damage to make way for the rebuild. Once the site is cleared, tissue repair can finally begin. It's essentially like having a microscopic 3D printer inside you, actively laying down fresh collagen fibers to bridge a gaping wound in real time. Without that initial fire of inflammation, the essential rebuilding phase simply cannot happen.
Section 2, Oncology, or what we like to call rogue cells. Here, we're looking at what happens when a lightning strike mutation hits the DNA helix, completely scrambling a cell's basic programming and setting it on a path of unchecked replication. The absolute crucial point here is understanding how these rogue cells behave once they start multiplying. A benign tumor expands smoothly, just pushing tissues aside like a self-contained expanding balloon. It stays local, but a malignant tumor, that's a different story. It aggressively invades its surroundings, growing these terrifying spider-like legs that claw their way deep into healthy tissue.
To really understand why this happens, we need to look at the genes driving the cell cycle. I absolutely love this car analogy because it hits the nail right on the head. Proto-oncogenes are the genes that tell the cell to divide. When they mutate into oncogenes, it's exactly like a stuck car accelerator. The cell is just speeding totally out of control. Tumor suppressor genes, on the other hand, are meant to stop division. When they fail, it's like having snapped brake lines. So a stuck accelerator with no brakes, that's exactly how cancer develops.
Time for another incredibly vital clinical pearl. Meet the p53 gene, basically the ultimate guardian of the genome. Before a cell is allowed to undergo mitosis and divide, p53 desperately scans the DNA for errors. If it finds damage, it hits pause to repair it, or it triggers apoptosis to kill off the broken cell. If p53 mutates and fails, well, those broken cells slip right through, and that causes major trouble.
Once cancer takes hold, we have to have a way to track it. Enter the TNM Staging system.
T stands for tumor size, N tracks node involvement, and M looks for distant metastasis. This metric is a real game changer for diagnostics because malignant cancer cells love to hitchhike across the lymphatic highway, actively looking to colonize distant organs far, far away from where they started.
Section 3. Hematopathology, or blood in crisis. Now, before we look at the blood itself, let's take a second to appreciate the incredible human blood circulation system it travels on. Your heart is an absolutely relentless double pump, constantly driving blood through two distinct loops. You've got the pulmonary circulation loop, pushing blood to the lungs to grab oxygen, and the systemic circulation loop, which pumps that highly oxygenated blood out through a vast, complex network of blood vessels to every single corner of your body. And right at the source of all that circulating blood, the high-energy bone marrow factory. This incredible manufacturing center is constantly churning out a diverse, highly specialized army of red and white blood cells that supply that entire circulatory system.
Let's test those detective skills again with another myth versus fact. When a patient is anemic, their red blood cells shrink and lose that vibrant red color. But here's the question: is anemia always simply a matter of lacking iron? The fact is, anemia is vastly more complex than just needing an over-the-counter iron supplement. It represents a fundamental failure in one of three areas. It could be a failure of the bone marrow to produce enough cells. It could be systemic destruction, where the body is prematurely destroying its own red blood cells, or it could be massive, sometimes hidden, blood loss. As a detective, you have to figure out which of these three mechanisms is the real culprit.
Now let's contrast two major blood cancers. Leukemia behaves almost like a massive system glitch. Immature white blood cells, called blasts, completely overwhelm the bone marrow and the blood, literally drowning out the healthy cells. Lymphoma, however, is a solid tumor of the lymphatic system, causing the body's lymph nodes to flare up like red warning beacons. Because blood is pumped under such high pressure through those pulmonary and systemic loops, it has to protect itself from spilling if a vessel gets damaged. That brings us to the coagulation cascade. Think of this as an incredibly intricate, rapid Rube Goldberg machine. One clotting factor triggers the next, which triggers the next, in an exact, rapid sequence designed to stop bleeding instantly. It's beautifully orchestrated, but if just one single domino is missing, the entire machine fails, leading to severe bleeding disorders.
Conversely, sometimes blood clots when it shouldn't. This clinical pearl highlights Virchow's triad, which is basically a spinning three-part gear system driving pathological blood clotting. The gears are blood stasis, which is sluggish flow, hypercoagulability, meaning the blood is overly prone to clotting, and endothelial vessel injury, which is physical damage to the vessel wall. When these three gears interlock, you get dangerous clots that can travel right back to the heart or lungs.
Section 4. Systemic pathology. We've looked at cells, tissues, the heart, and the circulating blood. Now we pull back to see the big picture, where the entire human body becomes the ultimate diagnostic puzzle.
Everything is connected like a giant web. In cardiovascular pathology, as the heart pumps through its systemic loops, you might have a valve slamming shut under high pressure, causing stenosis. Over in respiratory pathology, something like inhaled smoke particles can turn a pink, healthy lung into a rigid, fibrous cage. In renal pathology, the high-tech filtration mesh of the kidney might begin to leak protein. And down in gastrointestinal pathology, we can witness the deep scarring of cirrhosis, battling against the liver's otherwise incredible regenerative abilities. Speaking of the renal system, let's look at one final myth versus fact. When that delicate filtration mesh in the kidney breaks down like a busted sieve, does the resulting kidney failure happen all at once? Do patients just wake up one day suddenly lacking kidney function?
The startling fact here is that kidney failure is a slow, silent thief. Unlike something like endocrine hormones, which act like rapid heat-seeking missiles flying through the bloodstream to hit targets instantly, kidney disease progresses so slowly through invisible stages, and the body compensates for a really long time, meaning severe damage is often done way before the very first symptoms even appear.
And all of this brilliantly illustrates exactly why your role as a medical detective is so vital. Every single biopsy tells a unique story of survival. The human body is a miraculous, self-healing machine, but when it breaks, the microscopic clues are always there, just waiting to be found. So the next time you feel a scrape heal or your heartbeat, ask yourself, what microscopic wars are being fought inside of you right now? Thanks for joining us on this explainer. Keep investigating.